Our next candidate is Gerry Purcell.
He
hails from Forsyth County, and he recently spoke at the Walker County Republican Party earlier this week. Thank you.
That's going to be heavy part of this meeting.
Thank you, Mr. Chairman. It is indeed a privilege to be in my home district today. It is wonderful to see you. I look forward to meeting those of you who I have not met, those of you who may not know much about my background. Just to tell you, I'm the son of a Baptist pastor for 55 years, grew up in Toccoa and Northeast Georgia. I am a former military intelligence officer. I have been successful in business, turning around 5 failing multi-million-dollar businesses to profitability within 12 months. I'm a cancer survivor. I was diagnosed with cancer at the age of 29, and since then I received my calling to be in healthcare. And I've been in healthcare since then, and what I've been doing in the last few years is helping cities, states, and counties actually use free market healthcare solutions to save money. So I know that we can do that without what's about to happen in Washington. I want to introduce my wife, Julianne, who is here with us today. She travels with me over most of the state. She's definitely my better half. It's a privilege for us to be here with you. There are 2 reasons why I am running today. Number one, what I'm hearing from thousands of people across this state, that it is time for new leadership across America, across Georgia. New voices and new leaders in the Republican Party. And the second reason that I'm running is because I do not want the federal government to decide who gets to live or die. Now you can see this chart I have up here in front of you to my right. That is what Obama thinks is simplified health care. It's not my idea of simplified health care. And we're going to do everything we can do to fight it. And I'm going to give you a practical idea. We're not just talking about it, we're going to do something about it. But as Insurance Commissioner of the state of Georgia, I'm going to do a few things. First of all, we don't have sunset laws in the state of Georgia. We literally have in Title 33, our insurance code, laws that have been on the books for over 100 years. Many of those laws are discriminatory towards small business. So we're going to audit Title 33 and go through it with a fine-tooth comb. The second thing we're going to do is disclose the tax. Now what do I mean by the tax? I mean the second highest health care tax in the United States of America. Right here in Georgia, we add 5% to every health care tax, and 99 out of 100 of our citizens don't even know about it. Now, I don't like high taxes, but I can tell you that even less I like hidden taxes. So on every policy statement, I'm going to ask the insurance companies to put the amount of that tax on every statement so the citizens can know that they're paying it. Now the problem, thank you, the problem is we're not going to get rid of that tax overnight, but it is the right of every citizen to know that that tax is there. No more hidden taxes. If we want to reduce the cost of health care in Georgia, which is up in the top third, then let's lower taxes. And let's use those taxes if we're going to collect them for health care. We have 225,000 people in this state that cannot get coverage, and we're not using any of that money for health care. The third thing, I'm going to fight so that Georgians can buy insurance across state lines. If you can get a health care policy in Iowa for $98, that same policy costs you $200 in Georgia and $400 in Massachusetts, then let us buy our insurance from Iowa. That would increase competition. And then finally, we're going to protect health care for Georgia. Now we have a thing that and this is the first group that we're releasing it to, it's called the Georgia Healthcare Freedom Act. I want to read it to you quickly, just a sentence. We, the citizens of the state of Georgia, believe that all people should have the right to make decisions about their health care. And thus no law shall be passed that restricts a person's freedom to choose a private health care system or private plan of any type. And it goes on to say more about no penalties, no mandates. Federal government, stay out of our health care in Georgia. Now, since 11 o'clock last night, we have signed up over 250 people for this Georgia Healthcare Freedom Act. And we're on Facebook. We have these red flyers. I'd like to make sure that each of you have one in your hands to pass out to your friends and neighbors. Jim Elger is over here with a sign-up sheet. We want to ask our legislators to get behind this, and let's put this referendum on the ballot next November. That's actually doing something about it. We're going to follow in the lead of Arizona and Governor Rick Perry in Texas, who is beginning to do the same thing. Now let me close. I am not in the least bit discouraged. I am concerned about what's happening in America. But as a man of faith, I remember the story of Nehemiah. And you may know this story where he went into Jerusalem and the walls of Jerusalem had crumbled down. Literally in 57 days, with nothing more than a mandate and a mission, Nehemiah rebuilt the city walls of Jerusalem. If he can rebuild the city of Jerusalem in 57 days, we can take back our country in 12 months. God bless you. God bless America.